So the clinical pearl of today is about the chronic wound care clinic, some thoughts on the ideal wound care clinic from a physician point of view. So what would be the ideal wound care clinic? What I think it would be, I think it would be patient-centered, like it would be evidence-based medicine. It has also to be lean-based, so preserving value with less work. You have to have good links with your local hospital. You have to have good links with regional and provincial healthcare organizations. You also have to have the knowledge of various paying agents, so professional fees, operating budget of your clinic. You have to know how the medications cost, the dressings, and so on. The multidisciplinary team approach, there is a prerequisite to good chronic wound care. And this approach is really recognized by different associations in Canada and in the world. So the Canadian Association of Wound Care, the International Working Group on the Diabetic Foot, the National Institute for Health and Clinical Excellence in the UK, and also the World Union of Wound Healing Society recognize that the multidisciplinary team approach is really a prerequisite. Also, different other specialists recognize that. Recently, in 2011, the American Society of Plastic Surgeons in their PRS journal had a very good text on chronic wound care, and they admit that the multidisciplinary team approach is really a prerequisite to good chronic wound care. Why do we need a multidisciplinary team approach in dealing with chronic wounds? Because we have a lot of wounds that originate from many etiologies. So if you take a look at the type of wounds we have in our clinic, chronic wound care, we have like burns, we have surgical, mainly diabetic foot ulcers, which accounts for 27%, but would probably be more, 30-35% right now. Inflammatory ulcers, arterial ulcers, cancer, pressure, radiation ulcers, traumatic, and venous ulcers. So a lot of ulcers, a lot of etiologies that need a lot of specialists we have to deal with. And all the people we need to deal with must be not too far, and they have to be part of this ideal multidisciplinary team. So you have here a lot of specialists we have to deal with. So it goes from vascular surgeons to infectious diseases, intervention, radiology, dermatologist, diabetologist, nuclear medicine physician, orthopedist, hyperbaric medicine physicians, plastic surgery, dietitian, physiotherapist, kinesiologist, social workers, neurologists, community nurses, and ergotherapists. And in the middle of all these specialists, there is the wound care clinic physicians working with their expert nurses. So this is really a team work. The organization of the team around the wound care clinic is easily said, but not always easily done. You have the necessity of at least one physician in the team. This physician must have interest and ability to work in a multidisciplinary team. So the wound care nurses, other medical specialists, there are a lot of people the wound care physician has to talk to, and he has to have the ability to work with these people. The physician must have the expertise in wound care. He has to have the time, and he has to accept to modify his practice, because it's a little bit different than doing family medicine. It's different than having a dermatology practice or a vascular surgery practice. You have to be able to work with administration, not against, because chronic wound care is not really recognized by most hospitals, most regional, provincial, and national administrations, and you have to get the people, you have to pay these people, you have to pay for technologies, you have to pay for dressings, and it's really important to have the ability to explain this to your administration, and you also have to be passionate about it. I think. Necessity to integrate the team as much as possible. You have to have collaborators as close as possible. Mainly, I would say in the hospital, you have to organize mixed clinics. So you have to organize plastic surgery clinics, infectious disease clinics. You have to organize clinics with nurses, anesthetists, and so on. You're going to have also written protocols accepted by all and available throughout the hospital. For example, protocols on therapeutic surfaces, and you have to also have to ability to have knowledge transfer and transfer the knowledge of these protocols throughout the hospital and also through community nurses. You have also to document, so you have to build data banks. You have to analyze these data banks and you have to submit to the administration. You have to prove that you're doing something by working with these chronic wound patients. So you have to get simple statistics. For example, inpatient pressure ulcers, amputation rate, and so on. You're going to have also medical protocols and knowledge transfer, like I told you a little bit earlier, written protocols such as description of wounds, therapeutic surfaces, use of complex dressings, and so on. For example, for a Granix that we have to use we used to in Canada, but it's not available anymore. Centil, Quecel Silver in burns, negative pressure therapy, and so on. I think you have to begin small, but you aim high. For example, the context of Hôtel de Lévis, the Hôtel de Lévis Hospital is a university hospital and a regional trauma center with all medical specialties except neurosurgery, thoracic surgery, and cardiac cath lab. So we began in 1999 with a dual-place hyperbaric chamber. And then we found out that many people with wounds were referred to our hyperbaric chamber, but the wounds were not taken care of appropriately. So we decided to create the wound care clinic in 2002 with only one bed and no nurse. So the physician would do everything, the debridement, the dressings, the undressings, the debridement, dressing, everything. So in 2003, we got one ostomy nurse, which was a lot of help. In 2006, we got a three-bed clinic with two ostomy nurses. So you can see on the pictures how the room is arranged. 3 beds. We have a small administrative spot, and it's in fact it's a usual 4-bedroom transformed for our needs. The 3 beds allow simultaneous assessment of 3 patients, 20 to 30 patients a day, especially mostly outpatients, but some inpatients also. So we have wound care nurses that do the initial assessment and test, that do TBI, neuropathy, and surgical debridement. It's not perfect, but it's better than nothing to begin with. So from 2006 to 2011, we developed service corridors with anesthetists, infectious disease specialists, vascular surgery, plastic surgery, diabetologists, intervention radiology, dermatologists, and so on. All these people are nearby or easily accessible for fast consultations. From 1999 to 2011, we purchased various wound care equipment, TCOM, infrared thermometer, biothesiometer, teleconsultation conference equipment, portable vascular lab to come, and so on. And from 2010 to now, we are trying to create a research center in hyperbaric medicine, but also in chronic wound care. So you can see here our hyperbaric chamber, infectious disease specialist discussing with a plastic surgery resident. You can also see a plastic surgery resident doing debridement on diabetic foot ulcer, and you can see the old fax machine, which is still very often used in our clinic, simply to fax some things we want to do on the patient. So you have to keep the link with the community nurse, and that data sheet that we fill with each patient is sent to the community nurse, so they know exactly what is the treatment plan for the patient. We also have telemedicine, so it's been in Lévis for the last year. So we have about 20 centers linked to our center. So we do consultation, physician to physician. We evaluate patients. We do teaching. For example, right now it's one of our nurse doing teaching to another nurse. She's teaching to debride and the nurse is around it's more than 500 kilometers away, so that telemedicine is very helpful, and it will be a lot more in the future. If you have the time, it will be worth it to get involved with students and residents at the Faculty of Medicine or Nursing. Our centers is affiliated with University Laval, so we have some responsibilities for teaching students and residents. So we have to do classes to pre-meds. We organize resident rotations in wound care, and we have had other special learning projects. So the students and the residents are really the physicians of the future. Presently, wound care and the multidisciplinary approach is not really taught at the Faculty of Medicine, but I think it must be taught at some time in the medical curriculum, and rotation in chronic wound care like ours, I think, is a good thing for the residents. You also have to get, if possible, involved in local to national committees. I think it's really positive to the wound care community in the country, but also in your area. And if it's possible, also research is really important. So the challenges is there are many challenges. The first one is recruitment. You have to keep your dedicated wound care physicians. There are a few physicians that are interested in chronic wound care, and it's probably because of payment issues. It takes a lot of time. Chronic wound care patients take a lot of time, and sometimes there is payment issues, and it's kind of different from a dermatology, a full dermatology practice, or a family medicine practice, or a vascular surgery practice. So it's kind of really a challenge. You have to keep the multidisciplinary team as much as possible in close proximity for more efficient and fast interventions. You have to try to keep your expert nurses. So you have to go to the administration and demonstrate to them that the chronic wound care clinic is very efficient with statistics that you have built. Never lose the link with community care. I'm just repeating myself, but good description of therapeutic plan. You have to be able to respond to their questions by phone. You have to be available for their patients to be seen in reasonable delays. And you have to be able to use new technologies, especially for knowledge transfer. And finally, it's often a crusade, but I think it's worth the cost and the efforts for our chronic wound care patients.